In a statement to KARE 11, a United Healthcare spokesperson said, quote, based on feedback from our provider partners and discussions with medical societies, we have decided to delay the implementation of our emergency department policy until at least the end of the national public health emergency period, end quote. That new policy, covering 37 states and does not include Minnesota, would give limited or no coverage for ER visits deemed not an emergency after the fact. A 2019 report by United Healthcare suggests about two-thirds of all ER visits that year were unnecessary, costing an added $32 billion in healthcare costs.
It's just not in the best interest of patients. It's misguided.
CEO of the American Hospital Association says a delay is good, but they want to see United Health's new policy dropped for good, believing it'll lead to people putting off needed care.
Our focus as hospitals and health systems, as doctors and nurses, is providing care. Unfortunately, the insurance folks, they seem to be in the business of denying care.
In a statement, the president of the American Medical Association said, quote, we object to United Healthcare's pending policy that asks patients to second-guess their instincts that emergency care is needed. Patients should not be expected to self-diagnose to determine whether, for example, chest pain is a heart attack or indigestion, end quote. United Healthcare's new policy could kick in as early as July 15th, when the federal public health emergency is set to expire, though it could be renewed for another 90 days. Chris Aramsky, KARE 11 News.